Hi everyone, my name's Tristan, and the next topic that we're going to be talking about for our series of videos on paediatric emergency department presentations is gastroenteritis. And as with the other videos, we're going to be aiming this at the level of doctors either newly graduated or new to the emergency department or new to the paediatric emergency department in the first few years of your training, and probably also applicable to medical students, but not really useful to fellows of emergency medicine and paediatrics, fellows of paediatrics, people that are kind of at the advanced end of the spectrum. This is more of a basic series of videos. So what are we going to cover here? Well, the things you're going to be able to do from this topic is you're going to be able to diagnose gastroenteritis, distinguish it from other common causes of vomiting in kids. It's not an exhaustive treatment of vomiting in kids. You're also going to understand the basics of hydration status assessment and some of the limitations with that. And then you're going to know how to rehydrate a child, which, as I'll come on to later, is mostly going to be either orally or NG, but I'll touch on IV hydration briefly too. So the take-home points are: beware of vomiting that occurs without diarrhoea. You can't assume that that's gastroenteritis. The second point is beware of severe pain or anything to suggest a surgical cause, so focal tenderness, peritonism, all of those things should prompt you to think this is not really gastro. The usual treatment for gastroenteritis, just hydration. This should be done enterally when possible, so that means ideally orally, sometimes NG, and then only rarely using IV hydration in severe cases. Stool cultures usually not required, and same with antibiotics. There's only a few niche cases where those are actually necessary, and most of the time you won't be needing either. So the topics I'm going to cover separately in the following videos are assessment in general of gastroenteritis, how to assess hydration status and the pitfalls of doing so, what investigations you might need when treating someone with gastroenteritis in the paediatric ED, and then how to rehydrate a child. I've used references that I'll put in the description below. I hope you find these videos useful. So let's get on to the next one, which will be assessment of gastroenteritis.